our second hour is brought to you by the folks down at MultiCare Incorporated, and they do all sorts of home care and personal care. And I believe we have Ben Shatto online. He is a physical therapist, and we're going to talk about in-home physical therapy. Good morning, Ben.
Good morning, Brenda.
Hey, thanks for tuning in and being here with us and sharing all your information. How often do folks need to use physical therapy in-home?
Well, it comes about probably more than you think, and it can be for a variety of different reasons.
A lot of people think of just like we have a hip fracture, you need sometimes physical therapy, but it can also be like things with stroke and that sort of stuff. Am I right?
Yeah, that's correct. It's very common to see a physical therapist for post-surgical rehabilitation, or maybe, like you said, a hip fracture, or maybe a total knee replacement or a total hip replacement. But we see a lot of folks just to regain strength, maybe following an illness such as pneumonia, flu, or an infection. We also see people with a variety of conditions such as Parkinson's, or maybe they have had a stroke or a heart attack.
A lot of neurological conditions, I can imagine, would actually need some physical therapy.
Yeah, there are countless neurological conditions out there that could result in physical therapy. Some of the most common ones are a stroke or maybe Parkinson's disease. We see people just for general exercise training. Maybe they've gotten a little debilitated over the years, and we'll see them just to regain strength and to help them with their balance, to reduce falls in the home.
And that's really important, that reducing of falls, because once someone falls, you end up with a head injury and all those other complicating factors, which then makes things much worse. So if someone is unsteady, just giving a call and getting an evaluation can sometimes be important, isn't it?
That's very true, yeah. If we can prevent falls, we've done a lot of good for folks, because there's just so many things that can happen with a fall. Most of the time that you might end up with some bruises, but fractures are very common, as well as, like you said, head injuries. There's just a variety of things that can happen, and none of them are really that good.
I can't think of anything. I cannot think of anything good coming from a fall, just off the top of my head.
Not usually. Not usually.
All righty. And we really appreciate you guys being the sponsor of our second hour. How do folks get hold of you if they want to have a assessment, or if they need some physical therapy, or just in-home care or personal care?
Yeah, we can be reached at 884-5497. Also on the internet at MultiCare Inc. That's INC.com.
All righty. Thank you so much, Ben, for being here. And we appreciate your support of the program.
Great. Thank you so much, Brenda.
All right. You have a great week.
You too. Bye-bye.